Picture this scenario. A key account manager arrives at a hospital for a scheduled meeting with the head of the clinic, only to be met by a note at the door saying, "Gone to meet with medical affairs. Be back in 60 minutes. Sound familiar? Let's be honest, it's happening across healthcare systems everywhere. KAMs are struggling for access, while medical affairs teams are welcomed with open arms. Hi, I'm Mats Fogelqvist. I'm the CEO of Crossfell. And today we're going to talk about an uncomfortable truth in pharma. The traditional key account manager is at a crossroads. But unlike what some might predict, it's not about extinction, it's about evolution. Let's look at what's actually happening in healthcare systems today. Traditional product-focused KAM approaches are yielding diminishing returns. And it's not because KAMs are not trying hard enough or because the product isn't good enough. It's because decision makers are concerned with other things. Now, take a guess. How many percent of a decision maker's brain do you think is occupied with thinking about you and thinking about your product? Sorry? Did you say 0%? Well, if not 0, I do think it's closer to 0 than 1%. And this means that if you're product focused, you're not being that relevant to these decision makers. No wonder KAMs have a hard time getting access to them. So pharmaceutical leaders are asking some valid questions. Should we just replace KAMs with more medical affairs staff? Is the KAM role still relevant? What's the unique value proposition for KAMs? And believe me, these are fair questions, but they are based on a fundamental misunderstanding of what healthcare systems actually need. When we examine what healthcare systems across the world are struggling with today, we discover three distinct domains where they seek strategic partnership. First, we have strategic and economic challenges. You know, the stuff that keeps healthcare administrators awake at 3 a.m., like budget constraints, resource allocations, and policy changes, etc. In the second domain, we find operational excellence barriers, the daily fires that managers and staff are constantly trying to put out, barriers in the patient flow that impacts patient outcomes negatively, staff shortages, process inefficiencies, etc., etc. And finally, in the third domain, we find scientific and healthcare environment issues like treatment guidelines, interpreting clinical trial data versus real-world data, and patient outcomes, etc., etc. And most KAMs, who often have a clinical or scientific background, often default to product and data discussion. And this is the same territory where medical affairs naturally excels. Here's the uncomfortable truth. Today's KAMs are largely competing with medical affairs on the same scientific and clinical territory. And they are losing that battle. It's not surprising. Medical affairs typically have a deeper scientific credentials, and they have more clinical training, and they have fewer commercial constraints. So of course, medical affairs are winning the scientific discussion. But look at what's happening here. While everyone is fighting over the scientific territory, we have two massive areas of healthcare needs that are going completely unaddressed. The strategic and the operational domains are not just underserved, they are practically deserted. Practically no one from pharma is having meaningful conversations about resource allocations, about treatment pathway optimization. But this isn't a problem. This is what we call an opportunity. This is a chance for KAMs to stop competing in an area where they are at a disadvantage and start pioneering new areas where no one else is playing. And I've seen firsthand what actually happens when they start doing this. All of a sudden, high-level decision makers' attitude shifts and they start leaning in, excited that the KAM for the first time in years are being relevant. So the future KAM isn't just trying to be a less credentialed version of medical affairs. No, they're pioneering totally new value propositions with capabilities that healthcare administrators are asking for and need, but rarely receive from pharma. Like strategic intelligence expertise, understanding what keeps healthcare executives up at night, from policy changes to budget constraints. Topic most KAMs currently don't even touch. Operational excellence consulting, developing genuine knowledge about patient flow, process optimization and resource allocation. Areas where healthcare is struggling, but pharma rarely engages. Value demonstration beyond clinical data, moving beyond our drug works better to show impact on metrics that administrators actually get evaluated on, like length of stay, resource utilization, and operational efficiency. And cross-functional orchestration, not competing with medical affairs, but creating a coordinated approach where each brings their specialized expertise to different stakeholders. So with medical affairs owning the scientific conversations and KAMs focusing on the strategic and the operational areas no one is addressing today, you're expanding your company's influence across the entire healthcare decision-making ecosystem. So, how do you transform your KAMs from product-focused scientific messengers to strategic operational experts? Well, here's where Connect comes in. Connect is designed specifically to help KAMs develop expertise in areas they've never explored before, like strategic economic and operational intelligence gathering. It uses AI to help KAMs rapidly build knowledge in these new domains, identify patterns in healthcare systems, and generate insights about operational and strategic challenges that administrators actually care about. This isn't about asking KAMs to acquire healthcare administration degrees. It's about giving them a new framework and new tools that helps them pivot the existing relationship skills they do have into conversations that healthcare decision makers have been waiting for. As one KAM told me after using Connect, "For years I've been trying to get a very influential chief medical officer to join our speaker program and talk about our clinical data. And just 2 weeks after using the Connect framework, I had a 45-minute meeting with him about patient flow optimization. I didn't even know that that was possible." So thinking about what the future customer engagement will look like for pharmaceutical companies, it isn't about choosing between more of medical affairs and less of key account managers. No, it's about clearly defining the two different roles because they both serve an important purpose. And together they represent a big opportunity to expand your company's influence across healthcare systems. So the question for pharmaceutical leadership isn't about whether you should keep KAMs. It's about whether you should keep deploying them into battles they can't win or reposition them to new territories that's wide open for the taking. So are you ready to transform your key account managers from scientific messengers to strategic partners? Let's connect about Connect. The details are in the description below. Thanks for watching. Bye bye.